Jai Gurudev, welcome to Mahashi's Global Family Chat on the 3rd of June 2017. In the last month, we have heard from Dr. Ken Kavanagh about the latest research on the Mahashi effect in reducing mortality and accidents in the United States. We also have heard from Dr. Guy Hatchard about the economic effects of the Mahashi effect as it is implemented in countries. And this evening we're going to hear about something related but not quite the same, and that is from Dr. Robert Heron, who has been a researcher at Mahashi University of Management for many years, decades, about the effect of Transcendental Meditation on reducing healthcare costs. So this is not about the Mahashi effect, but about just the practice of Transcendental Meditation on reducing healthcare costs. So a warm welcome to you, Dr. Heron, and please go ahead. We're all just waiting to hear about this thrilling research.
Jai Gurudev. Rising healthcare costs are a major challenge to countries all around the world, to corporations that pay for the healthcare costs of their employees, and even to families and individuals. The United States has the highest healthcare costs in the world, but if you look at the entire world situation, every nation in the world has rising healthcare costs, and it's a big concern because these costs are getting so high, it's challenging the economic viability of many governments and corporations. So it's a big concern. When I did my PhD at Maharishi University of Management, we studied how executives make decisions. And we would think that decisions are made based on their effect on life and the quality of life. But sadly, too many decisions are based on the bottom line or costs and budgets. So I decided to study that because the other areas had already been studied. You see here various countries around the world and their total healthcare cost in US dollars. Again, the US is the highest, but we see that many other countries like Switzerland and the Netherlands, Germany, and others have very high costs that they would like to reduce. In most developed nations, healthcare is the largest industry in the nation, and it often accounts for the largest expenditure or the second or third largest expenditure in most countries. So it's a big challenge to these governments to maintain the solvency of the government and also provide good health for their people. Next slide, please.
We cannot read the names of the countries. Could you just read the names of those countries so that we can see which country comes where?
Okay, US is highest. Next is Switzerland, Netherlands, Germany, Sweden, Austria, and then they have the comparable country average. Next, below the average is Belgium, Canada, Australia, France, Japan, United Kingdom, and then they have the average for the OECD countries, which is a cluster of developed countries, about 32 countries.
And Dr. Heron, why are they so much higher in the US and why are they lower in Japan, for example? Is it because people are healthier?
Well, it's part of it. Actually, in Japan, people do live longer and have a healthier life than people in the United States. But there are many reasons why things are very high in the United States. Part of it boils down to the campaign finance system in the U.S., which is very unusual, where large corporations, pharmaceutical companies can make donations and get special privileges in how they operate in the healthcare system that keep the costs high. Other countries have better cost controls, and cost containment is the major goal in the U.S. and all these countries actually. In most countries, leaders don't even think about reducing costs. They're happy just to contain the rate of increase. Healthcare costs are very unpredictable. They can go up 3% in one year or they can go up 15% in the next year. They just never know what's going to happen next.
And what would drive them up 15% suddenly?
Well, many factors, but the most important one, as far as we're concerned, is utilization. There's a very simple equation. Total healthcare costs equal price of medical services times the use of medical services. Now, a lot of factors go into the price, government regulation, special interest groups in the medical industrial complex. And by the way, in the US, the medical industrial complex is nearly 4 times larger than the military industrial complex. So there's market competition. So a lot goes on to that price. But what we want to focus on is use, because if nobody used medical services, healthcare costs would be almost zero, except for ladies having babies in the hospital. So that's what we focus on with the TM technique. We can't get into the complexity of trying to reduce prices. Governments around the world have been wrestling with that for decades and not made much progress, especially in the US. But so now here again, we see that healthcare total health expenditures have been rising for a long period of time, especially in the United States. But in the middle of the graph, you can see the average there for a comparable country with the same level of medical services as the US. So all costs are rising worldwide. Now, here we see the extraordinary situation in the United States where healthcare spending has increased over 800% since 1960, which is much faster than the growth of the GDP. So, and is much faster than wages. So this puts a huge pressure on individuals who try to buy individual insurance and companies, and of course the government as well. In the US, the government pays for about half of all medical costs through the Medicare program, Medicaid, Veterans Health, and military health programs.
This is amazing. Are we seeing this correctly, that since 1960 in the US, wages have increased 16%, GDP has increased 168%, and the national health expenditures have increased 818%.
That is correct. And that only goes up to 2010. It's even worse than that now.
That's extraordinary. So how does the nation keep afloat?
Well, on the next slide, I'll explain more about that. Okay, here we see percentages of the gross domestic product, or the total economy, that are devoted to healthcare. In 1980, it was 9% in the US. Now, this chart was made a few years ago, and you see they estimate that it'll be 19% of the GDP in 2020. Well, we're already there at 19%, and we're going to be at the 2025 goal probably this year or next year, or 20%. Now, why is this important? Well, the GDP is the total income of the economy, and as more and more resources go into healthcare, that means resources are being withdrawn from food, housing, education, transportation, job creation, and other high priorities in the economy. So it's like, I hate to make this analogy, but healthcare is like a big cancer, absorbing more and more of the resources of the country. And a big question for health economists nowadays is how much of the GDP can go to healthcare and a country continue to still function as a country. I mean, people have to keep eating, people have to have houses and new clothes and education for the children and young people. How much can it, it can't go over 50% for sure, but when does it, at some point there has to be a breakdown in the entire economy if it keeps going up. Does that answer your question?
Yes, it does. And I remember Maharishi saying once in the late 1970s, he said there are 5 major big rakshasas in the world, and the pharmaceutical industry was one of them.
That's absolutely correct. I don't want to dwell on that much, but the pharmaceutical industries worldwide are the most corrupt, I guess, after the mafia. Okay, what we are looking at now are the estimated independent effect of selected health risk factors on annual medical costs. Now, you asked the question, Dr. Swan, what is driving healthcare costs? Things like blood pressure, tobacco use, exercise, body weight, and then on the far left in red, high stress and highest of all, depression. The great research has been done and found that in terms of use of healthcare, stress and chronic stress are the highest drivers of healthcare cost. That's been found in many studies. Chronic stress and depression drive costs higher than anything else, more than blood pressure, more than tobacco, more than obesity, and even drug and alcohol abuse. So this is an ideal solution for the TM program to solve, because you presented so much research over the years showing how the TM program reduces stress, especially chronic stress. A little bit of that research, but now we might wonder, how does chronic stress cause high and rising medical costs? Well, there are many sources of high costs. Actually, here in the US and most developed countries right now, unemployment and worry about the economy and debt and jobs and so on are the major source of stress in all the polls and surveys. Now, chronic stress has 2 major impacts. It drives unhealthy lifestyles and behaviors like alcohol and drug abuse and tobacco use and improper eating, a lack of exercise. And on the other dimension, you see that chronic stress causes direct damage to the physiology. The most important one is chronic stress weakens the immune system and makes a person more vulnerable to all kinds of diseases, both heart disease, cancer, which are the number 1 and 2 causes of death worldwide, but many other disorders are also affected by stress. Now, stress either causes, aggravates, or contributes to most of the diseases a human being can have. And 75 to 80% of all medical expenses are caused by chronic conditions, and chronic stress is a major driver of chronic diseases. So this is how it works. It's people might wonder, how does a mental technique affect something very physical like money? Well, this is the chain of causality, how it happens. And the TM program, of course, works on the chronic stress to reduce unhealthy lifestyles and behaviors and decrease and repair the direct damage to the physiology. Here we are with the Transcendental Meditation technique. It works on a very deep level where we experience transcendental consciousness. It's could be thought of as an automatic self-transcending technique. We have deeper relaxation, more coherent EEG, and a deep state of restful alertness. It's to be differentiated from mindfulness techniques, which are focused attention and open monitoring. And as you see on this graphic, those active techniques of mindfulness keep the mind on the surface, while the Transcendental Meditation technique enables the mind to experience thought at finer and finer levels until thinking is transcended. And we transcend thought and experience a source of thought, which is a state of reduced mental activity, but also reduced physical activity. And it's this reduced physical activity that reduces the stress and tension that drives healthcare costs. Another thing that Transcendental Meditation does is it increases brain coherence. And research has found, of course, that the brain controls the body. And as the brain becomes more orderly through TM practice, then the body functions more harmoniously and in a more orderly manner, which means better health and lower healthcare costs. Okay, here's some of we'll just go over a little bit of the results. We see that TM causes increased physiological relaxation over several parameters. This is a very well-known phenomenon. Here we have a reduced anxiety, and this is a meta-analysis of 146 studies comparing transcendental meditation with placebos, other relaxation, other meditation, progressive muscle relaxation, biofeedback, other mantra techniques, and even concentration. And we see that the TM technique is more than twice as effective in terms of effect sizes, and that's what this graph is showing, than all these other procedures in reducing trait anxiety. Trait anxiety is a measure of chronic anxiety or chronic stress, and it's this chronic stress that's really the most guilty culprit in driving healthcare costs, because if we could reduce the stress levels, we could greatly reduce overall healthcare costs. The first study in this area was done by David Orm Johnson, published in Psychosomatic Medicine, and he found decreased hospitalization rates in a sample of 2,000 insurance enrollees who practiced the Transcendental Meditation technique, and he compared them with all other groups. And the TM technique reduced hospitalization in all categories of disease except childbirth, which is not a disease. It's a very wonderful thing. TM practitioners have the same number of children as other people, but we see in the red where there's a TM, it's much lower than the blue, which are the other groups that did not practice Transcendental Meditation. My question was, when I saw this research, well, if it reduces use, what is the effect on cost? So here's another graphic on decreased hospitalization and doctor's visit from the same study by David Orm Johnson. And we see now decreased hospitalization is important because hospital stays are the highest cost within the healthcare system. The highest cost are hospitals costs, second highest cost are physician fees, third highest cost are drug and medication. So it's so important. You have the number one cause of a high cost there, hospitalization on the left, and on the right, the second highest cost, doctor visits, and they both decrease with TM. Okay, in explaining how TM reduces healthcare cost, we need to focus on a certain phenomena called the high cost phenomena that we see worldwide. Basically, healthcare costs are highly concentrated within every healthcare system in the world. And here's an example from the US population. We see that the highest spending 10% of 1% on the left account for over 20% of healthcare costs. The highest spending 5% almost account for 50%, and the highest spending 10% account for 65% of all healthcare costs. Mm-hmm. Now, the interesting thing here is there are two categories of people within these high-cost groups. There are people that have one-time healthcare costs, and they put them in a high-cost group. Maybe they're in a car accident, and they have to go to the hospital for many days for recovery and treatment. But they're never there again. They just become a normal person. But within the high-cost group, there's a group which is about half the people in, say, the highest 10%, who are there every year. They'll be in the highest at least 10% or 20 or 15% year after year after year. And these are what we call consistent high-cost people, and they have very specific characteristics. They tend to have several chronic diseases like hypertension, diabetes, and one study said that on average they have 5 or more chronic diseases, which of course drives them to through the healthcare system a lot. They also have very unhealthy lifestyles. They tend to be overweight, smoke cigarettes, abuse alcohol, and maybe drugs too. They tend to have very risky lifestyles with risky driving and things like that. So, and they tend to neglect a regular, normal amount of exercise. So we have these consistent high-cost people. And this became the focus of my research, because these consistent high-cost people, because they account for such a large percentage of total healthcare costs, if you can reduce the cost of these consistent high-cost people, you can leverage a very large reduction in national healthcare costs. Now, leveraging is a term we use in finance, which means you can make a small investment and get a big result, a big payoff. Now, we would like to see everybody in the population practice transcendental meditation, but some governments will say, oh, well, we can't afford to pay for everybody to start TM, but just the highest cost 10% who are consistently up there in the high cost group, they could afford that. So for a small investment in this relatively small group that accounts for most of the cost, they can leverage a very large decline in their overall health spending. Now, I remind you, health cost policy leaders and medical people don't even think of reducing costs. They think it's a big deal to reduce costs from 10% a year to 3% or 1% a year. Okay, I did 2 studies on consistent high-cost people. And this one we see, this one was done in Quebec, Canada, and the other one was also done in Quebec. We see a 35% reduction in healthcare cost over a 5-year period. And this is a huge finding. Nothing else has ever been discovered that reduces healthcare costs for that long of a period of time. Now, I would like to point out that many things will reduce costs for 1 year. Almost any intervention will reduce cost for 1 year. Even suggestion, expectation, or even the placebo effect can reduce cost for 1 year. In my studies, I always look at least 3 years of data after an intervention, because these other interventions and placebo effects and so on will not last long. The cost will go back to a very high level after the intervention. This could represent a huge savings to a government or a company, and you see the same high cost phenomena in large companies. A few people will account for the majority of costs. And
So
if you teach, yeah?
Sorry.
You had a question?
Yes. So what we see here is that the non-TM group, which is the red line, and the TM group, which is the blue line, that they both started off with the same expenditure, the same
Correct.
expenses, and then the TM group started getting less faster than the non-TM group. Now, why did the non-TM group get less? Why did their expenditure get lower?
We don't know. And the thing is, there's a lot of variability in healthcare costs, but you'll notice as time went along, their costs went back up again.
Yes.
And the TM costs continued to decline quite dramatically. Healthcare costs is especially for small groups, are highly volatile, and they just bounce all over the place. That's why I actually prefer looking at large groups, because when you look at larger groups, these, it could be, variation could be due to just 1 or 2 people having very low costs in 1 year for that non-TM group. But consistent, the TM group is very consistent, and it's going down very dramatically by year 5.
So 35% reduction, lower than the non-TM group after 5 years.
Exactly, yes.
And did you present this to any of the Quebec health authorities, for example?
Yes, I did. And I got a very interesting response. They were very grateful for the presentation, but they have a very strong doctors union up there in Quebec, and they were greatly fearful of a great loss in income, because this chart is measuring per capita payments to physicians for treating consistent high-cost people. So they were afraid of a very large drop in their income if TM became too popular among these high-cost people.
Did they admit that this was their fear?
The Quebec government did not admit this was their fear. Several doctors privately told me this was their fear.
Amazing. So their concern was not with the health of the population, but with their income.
I'm very sad to report that what you just mentioned is true in many countries, but especially true in the U.S. The U.S. healthcare system is just a money-driven system, and while you'll find many good, sincere people working there that work really hard to make people healthy, there's too much worry about money, and the bottom line is why you see such high costs. People help. I could give a course on why costs are so high in the U.S., but health insurance companies make more money when costs are higher because there's more money they can charge for premiums, and they use that to invest it in short-term investments, where they make more money in those short-term investments than they do on their profits from providing a health insurance. So they want to see more and more money pouring through the system so they can make those short-term investments. So health insurance companies, at least in the U.S., are the largest investors in expensive new medical technologies and new expensive pharmaceutical products, just so they can go to the government and say, oh, well, we need to increase our insurance premiums because, hey, there's this new expensive technology and we need to charge more. This is part of what's driving the costs up. But of course, pharmaceutical companies, as you mentioned, are very corrupt, and they're always money-minded and trying to drive the costs up and overcharging. On average, people in the United States pay 2 to 4 times more for the same medication people would buy in Canada or Mexico. So there's a huge amount of overcharging, and in the healthcare sector, they'll basically charge anything they can get away with in the U.S. I'm sad to say that it's sort of a negative thing to say on a very positive show like this, but that's the way it is. And the best way around it is not, as I said before, not to try to deal with the prices directly, but reduce the utilization by reducing the stress through the Transcendental Meditation technique.
Well, thank you for being open and honest about it. Please go ahead.
Next slide, please.
We take it as a sign of rising clarity in the collective consciousness when greater truth becomes apparent.
I like your positive take on that. But again, we see this phenomena of the TM group consistently going down over a 5-year period. Somehow the years got displaced there. But in this study, there's a higher p-value, which means it's more statistically significant for the TM group. And the changes even though there's a slight decline in the early years for the non-TM group, those declines were not statistically significant, but all the TM changes were statistically significant. And over the 5 years in this study, there was a 28% decline. So in different studies, you'd get different results, but there's one very consistent pattern that we see across all these studies. The TM greatly reduces reduces healthcare cost over time when other methodologies cannot reduce costs over time, especially over long periods like 5 years. And we'll look at one of the last slides, it's even over 11 years.
Dr. Heron, may I just ask, the last slide, was that
Yeah,
the
sure.
same? Was that the same group of patients as the first slide, as the previous slide?
They were taken from the same sample, but they're not exactly the same people.
Okay.
Both of these studies were taken from a larger group of 1,418 TM practitioners and another group of the same size of non-TM practitioners. And these two studies drew from high-cost people from that first initial study, where we took the high-cost people within that initial study.
Well, it's interesting that, you know, one is 35% reduction and the other is 28% reduction. So it's quite a similar reduction in both studies.
This is what we would call a ballpark reduction. And here we are again in that last chart with what we call absolute changes. Instead of comparing TM and non-TM, we're just looking at what happens over time. And we see the pattern of decreasing cost over time. And by the 5th year, it's quite large. Now, another high cost group within every population are the elderly, the people over age 65. Now, I'd like to point out that the consistent high cost people, their average age is actually between 18 and 64 in most populations. Consistent high cost people are the largest drivers of high costs, and they outnumber the elderly. But elderly will account for, even though they're about 12% of the population in the US, they'll account for about 34% of healthcare costs. But the consistent high cost people will account for the majority of the high costs being driven in the system. But we also want to do something for the elderly because they do have a disproportionately high number of healthcare costs. And this chart is kind of jumbled here. These people started TM about the 10th year of this study, at the 9th year of the study. And you'll see before TM, the costs were going up for both groups. The TM group is a blue line. The non-TM group is a red line. 159 people in each group, the same gender, age, and region of the province, and basically the same or almost the same healthcare costs before TM. After the people start TM, you see that their healthcare costs immediately start declining. Whereas the controlled group, they continue going up like everybody else in the population. Healthcare costs generally increase with age, and the highest healthcare costs are usually in the last year of life. And what does that tell us? Well, it tells you a lot of money is spent in the last year trying to revive or save a person, and it usually doesn't work because they die anyway. In fact, on average, about half to 70% of a person's lifetime healthcare costs will be in the last year of life. Okay, this is another way of looking at the elderly and their costs. There's not a big change in the first year, but you see by the 5th year, there are very substantial reductions in their healthcare costs. This is going back to another study done by David Orm Johnson and myself on the Vedic approach to health. Now, these people in the blue there, the MVAH group of 226, they're practicing Transcendental Meditation, the TM cities. They're taking Amrit Kailash, and many of them are doing Panchakarma regularly. And we're comparing them with insurance enrollees, the same, in the control group, they're the same occupation and roughly the same age, and the norms are people the same age throughout the entire healthcare system. And these are hospital expenses. And you see that the Maharishi Vedic approach to health, who use this more holistic menu of Maharishi Vedic modalities, has much lower healthcare costs than the control group. The control, of course, the people the same occupation and age, and then the norms who are only the same age. So again, this is a verification. Now, these people are not high cost. The Maharishi Vedic approach people are not high cost and they're not elderly. Please.
And the other people, the other groups, the norm is about $800. Is this high cost people or just norm for the US?
This is the average for everybody. This is the average for everybody in the Iowa Blue Cross Blue Shield healthcare plan.
Okay.
That's their average. Now, the average can be deceptive in a way. In fact, I call it the greatest Maya, because you need to look at the subgroups within. Because think about the high-cost people. It's the highest spending 10% that are accounting for most of those costs. So the lowest spending in any healthcare system, the lowest spending 50% will only account for maybe 3 or 4% of all healthcare costs. And the highest spending groups, the highest 10% or 15 or 20% will account for almost all the healthcare costs. So this is the average across all spectra. So we keep that in mind. If you looked only at the high cost people, we didn't have the data for the high cost people in this health insurance plan.
What's the control group?
Okay. Those are people. Now, this Maharishi Vedic approach to health group are professors and staff in Maharishi University of Management. And the control group are also professors at other universities in Iowa, universities and colleges in Iowa. So occupation is also a major predictor of healthcare costs. So we wanted to compare against something that would be a valid comparison. So these are college professors, basically, that are being compared in the control group and the Maharishi group.
And one other question, is the cost of Amrit Kalash and Panchakarma included in the MVAH group's cost there?
No, this study only looks at hospital costs or hospital utilization. So we don't consider the cost of Transcendental Meditation or Panchakarma or Amrit Kalash or anything else. All we're looking at is hospital expenses here only, which are the highest cost within the healthcare system.
Yes. Good.
And so it's important to reduce that highest cost. And it's also the cost that involves the most human suffering. Going to the hospital is extremely unpleasant experience for most people. Okay, in the blue, we have the TM group, and we have 1,418 people. Now, this is the overarching study that I mentioned earlier. And in the right-hand column, we see the non-TM group, which is also 1,418 people. Now, what we did is we got questionnaires and permission to access the physician costs of these 1,418 meditators and track them over time. And this was a 14-year study. And the Quebec government randomly chose by gender, age, and region of the province one control subject for each TM subject. So this is what we call a mixed design, where the TM practitioners are self-selected, but the control group is randomly selected. And anyway, we see an average of an 11-year annual difference between the groups. Now, this is all age groups, not the elderly, not the high-cost people. This is all age groups combined. So we see a 2% absolute reduction each year in the TM group and a 12% annual increase in the non-TM group. And that's consistent for many healthcare systems around the world. Healthcare costs are constantly going up. And to get any reduction at all in healthcare costs is an extraordinary find. In fact, you're considered a great hero amongst health economists if you can figure out a way to even slow those 12% increases to 3 or 4% increases. That's a big achievement within healthcare today. But to reduce healthcare costs over time, over many years. TM's the only thing that does that. And here we again see the percentage changes over time, over 5 years, without the control group. This is just what we call the absolute change from baseline for the TM group. And you see the large accumulation as over time down to 14% a year. Now, this is from the study that David Orm Johnson and I did on the Maharishi Vedic approach to health. And we got total medical expenditures per person over an 11-year period. And in the purple, you can see the norm, which is everybody else in the Blue Cross Blue Shield plan in Iowa. And in the gold, you see the TM group. In every single year, the TM group is much lower than the norms. So
around 500, one third.
Yeah, every year it's about 1/3 the cost. And why is this important? Well, it shows the consistency. And at some of the earlier slides, we were looking at physician's fees. This is total medical expenditures as paid by the health insurance plan. Does not include out-of-pocket spending, which is usually pretty small in these very generous plans. And we see a very consistent trend over many years. And Transcendental Meditation is the only thing that can do that. I just wanted to point out, this is another study I did with Robert Schneider. It's cost of treatment of hypertension, and Transcendental Meditation technique is much more effective than other forms of treating hypertension, and those were all drug-based interventions. And on the red and left, you see the standard drug therapies, and on the right, you see, far right in yellow, you see Transcendental Meditation. And it has the lowest cost over a 20-year period of time. We were looking at a 20-year simulation of costs for treating high blood pressure.
Can you read what those other things are? We see the yellow bar is Transcendental Meditation. What are the other bars?
Well, to tell you the truth, on with the graph as it is now, I can't see it either. So,
okay.
But it was what it is the number one. We chose the number 1, 2, 3, and 4, and 5 top medications for treating blood pressure at that point in time. We just went by utilization and prescription levels. The highest levels are prescription. But it was the 5 top. Actually, this study was published a few years ago. There are new medications that have come out since then. So, but some of these drugs are still used. Like the lower one, closest to TM is hydrochlorothiazide. Anyway, that's a diuretic, but it still costs more than TM over time.
Just to clarify, Transcendental Meditation comes in at about $3,000. Is this the cost of learning TM? And then you're comparing it with what? The annual cost of these drugs?
Okay. Yeah, this is the total cost over time. And we not only consider the cost of paying for the TM, but their economists will have to account for the amount of time spent meditating, because you could have been earning money for 20 minutes twice a day instead of practicing TM. Yeah, so we have to account for...
We know that it makes you more productive, so it's actually should not be added, it should be subtracted.
I agree with you, but the reviewers of the journal would not agree with that. You have to, economists have a funny way of looking at things. Now this is a very broad brush estimate, and this is an estimate if all the high-cost people within within the United States started Transcendental Meditation in 2016, last year. We estimate what their cost reduction would be by 2020 based on the past research that you looked at. And we very gross level, would estimate a $2 trillion savings over that period of time from 2016 to 2023.
This is
but of course, you see,
just for the U.S.
Just for the U.S. We can't do the world. We don't have the data for many countries. But yeah, the U.S. spends right now about $3 trillion a year on healthcare. It's estimated by 2023 to be at $5 trillion a year or higher. The way it's going right now, it'll probably be higher. But if you could get these consistent high-cost people to start TM, you could for a relatively small investment, leverage a very large decline and save approximately $2 trillion. About half of that would be saved by the government, and about half of that would be saved by the private sector. That would mean companies, because most employed people in the U.S. get their health insurance through their company. And of course, there are many people who are on private individual plans that they're paying for not through their company. So both corporations and individuals would save about $1 trillion over that time. And then the government would save about $1 trillion. Now that's important. Right now, the U.S. national debt is approximately $2 trillion and rising. And I've seen many reports where they say high and rising healthcare costs are the highest and most dangerous uncontrolled cost in the U.S. government. That's Medicare, Medicaid, and the other things that the government pays for. It's the greatest threat to the solvency of the United States government. Of course, military spending is the other high cost driver, and that's a whole different topic that I should not discuss. But if we just focus on providing TM to the elderly and to consistent high-cost people, we could save huge amounts of money, help make the government solvent. And it's not only the U.S. The U.S. is the most extreme case in terms of high cost. All countries could save a lot of money if they provided TM to the elderly and to consistent high-cost people. Of course, we would want everyone to start TM to have better health and to have a happier life. But the government should be interested because they can leverage the largest savings with these two groups, the consistent high-cost people and with the elderly people, because they're incurring the highest cost in most systems. So that's why we would strongly encourage governments to do this. And not all health insurance companies in the world operate the same as the U.S. There's many health insurance companies, both private and public, that could greatly increase their profitability and bottom line if they provided TM for their health insurance enrollees. For example, in the Netherlands, it's mostly a private system where people are required to buy private health insurance. Of course, for people with low income or the elderly, the government will subsidize the purchase of health insurance, but they have about a dozen health insurance companies, all of which are private and for profit. But in the way they operate, they could actually make money if they provided or subsidized or at least encourage their people to start the Transcendental Meditation technique. They could see a great savings there. But the greatest savings, of course, would go to the countries with the highest expenditures. Now, after the U.S., you see high costs in Switzerland and in Germany and Austria, and even Canada. People in the U.S. think, oh, if we only had a healthcare system like Canada where everybody's covered, everything would be better. But Canada is always in the top 10% of nations worldwide in healthcare costs, so they should be providing TM to their people. But again, we see mitigating factors like special interest groups like doctors and pharmaceutical companies that won't like this, but governments need to be brave and strong and do what's best for their people and provide the Transcendental Meditation technique.
Now, in this study, in this estimate, it's for high-cost people.
It's for high-cost people.
Is that like the top 1% or 5%, roughly?
It's the top 10%. Top 10%.
Top 10%.
Mm-hmm.
Top 10% of high-cost people, and that includes.
Well, it's the highest cost. The highest cost consistent. The 10% consistent highest cost people.
Okay, good, good. Whether they're elderly or young or doesn't matter.
It doesn't matter.
Yeah.
Yeah, that study I did in Quebec on high cost people, the average age was 46. And it's really amazing, some of these high cost people. Some of them are in their 30s. They have high blood pressure, diabetes, and many other problems. And it's just extraordinary to see how these people are and their situation in life. I would make the plea to give these high-cost people the TM technique simply out of compassion, because these high-cost people are really suffering. They have all these chronic diseases. They're often going to the hospital, which is a great discomfort to them and brings a great amount of stress, worry, and suffering to them and their families. So just from the compassion and angle and humanitarian angle, we should encourage TM in the health sector just to relieve this suffering of these people.
I remember I was teaching Transcendental Meditation in South Africa, and a man came to me. He was a farmer, had a huge farm, thousands of hectares, and his son had learned Transcendental Meditation and had advised him to come, and he was a very conservative man. But he came along and he had diabetes, cholesterol, high cholesterol, and high blood pressure. And he was on medication, permanent medication for all three of them. So I taught him to meditate, and then he said, "Oh, I've forgotten my medicines at home." And that was hundreds of miles away. So anyway, he went and stayed with a friend that night, came back the next day, said he felt fine, and he never took any of those medicines again, and he just felt fine. So that is a perfect example of a high-cost person learning Transcendental Meditation and just not needing the treatment any longer.
Let's multiply that times millions more. That's a beautiful story. And we can see that happening in every country in the world, across millions and millions of people. Yes. And they would have very similar stories.
Well, thank you very much. Dr. Heron, it's been most inspiring and very, very interesting. Great knowledge for any TM teacher to have in any country. We have seen how the Transcendental Meditation technique reduces the cost of medical care, and particularly this high-cost group of people, and seen how over 3 years in Quebec, the TM group was reduced their medical costs by 35%, another study 28%, so about a third of the medical cost was reduced, and that the particularly these the total medical expenditure, it was so impressive how that was reduced from approximately $1,500 per person to $500 per person, 1/3. So this is great research, and is this type of research still being done? Unfortunately
not. It's not being done. It takes money to do research, and right now the main funding for alternative medicine is going to mindfulness techniques, and it's very hard to get funding to do this kind of research in TM. So I wish we could continue. I'm continuing actually writing articles. I'm working on an article that's a review article reviewing all the studies that we've looked at and others and their impact on healthcare costs. And other issues in the paradigm itself. It turns out that another driver of high healthcare costs is the medical paradigm itself, which is highly fragmented. And a highly fragmented structure and knowledge causes a highly fragmented healthcare system. And a fragmented system requires more communication. And when there's a lot of communication, there are many lapses in communication. And in the United States, medical errors are the third largest cause of death. And a lot of it is due to these lapses in communication and the complexity of the healthcare system, which is due to the underlying structure and knowledge, which is quite fragmented. We need a holistic, unified theory of medicine. We don't have that right now. We don't even have a definition of health right now. By default, you're healthy if you don't have anything that medical science can detect, but there can be a lot going on before medical tests can detect a disease. We know that from Maharishi Vedic approach to health, but we even know that in modern medicine. Every physician knows there are what are called subclinical issues and subclinical problems. So I really should have more research on how knowledge itself affects healthcare costs. And medical knowledge needs more synthesis between disciplines and more integration and more unification to create a more holistic approach to health, like the Maharishi Vedic approach to health, so that we can have lower costs. Because this fragmentation, and which we study a lot in management studies, and by the way, my PhD is in management, not in medical area, is this fragmentation of the structure, the medical system, is a major contributor to high cost and medical errors, and something has to be done about it.
Thank you, Dr. Heron. It's been fascinating, and congratulations on this pioneering research that you have done, together in some cases with Dr. David Orm Johnson. It is a bright light showing the way that medicine can really perform its actual function, the function that it should be performing in reducing the suffering and the costs, particularly, as you say, the great suffering of the high cost group. So thank you so much for sharing this with us. It's something that we should all remember and be able to present to our own governments and health authorities at any moment when it is appropriate. Thank you so much. All our gratitude goes to Maharishi, who brought the knowledge from the Himalayas in its completeness and brought it to the whole world, and has transformed the quality of life in the world, which is getting better and better every day and every year. And we end now by ringing the bell of invincibility for every nation and for every individual on earth. Jai Gurudev.